All right. Good afternoon, everyone. Okay, let me start the camera. All right. Good afternoon, everyone. It's my pleasure to welcome you all to the today's webinar on a topic that is both timely and crucial: optimizing laboratory services by improving operational effectiveness. I'm Dr. Suranga Dolamulla, Vice President and Chair of Academic Committee, College of Medical Administrators, and Director Laboratory Service and Director Medical Research Institute. As we all know, laboratory services from the backbone of the modern healthcare systems. It's really from diagnostic to treatment planning, accurate and efficient laboratory services are critical in providing the best patient care can possible. So the challenges we face today is not simply how we perform more tests, but how we do the efficiently while maintaining the highest standards of the quality and accuracy. This means optimizing our workflow, reducing bottlenecks, ensuring data accuracy, and aligning our operations with the strategic goals of the healthcare institutions. This webinar aims to address these challenges by focusing on the key aspects of the operational effectiveness with laboratory services, including the process automation, data management, workflow priming, and resource allocation. Our esteemed guest speakers, as well as a panel of experts, will guide us through the proven strategies and innovative practices that can help us to elevate the standards of our laboratory operations. I believe today's session will provide us with the insight and tools we need to enhance the quality, efficiency, and sustainability of our laboratory services. Ultimately, improving patient outcome and contributing to stronger healthcare systems. Let me go through again. Let's see. All right. So once again, I extend warm welcome to each of you and look forward to engaging of the informative session. So let me introduce the speakers. First, I think we have got two speakers here. The speakers, I think we have got Dr. Asela from Ministry of Health, and as well as right. Then we have got another speaker from Australia. Anyway, he's also a part of our health system earlier. He's Dr. Dayanath. So the first speaker is Dr. Asela Disanayake. Is currently in Registrar in Medical Administration. He has been performed as medical administrator in healthcare setting. For example, Matale Hospital, he was the medical superintendent. So his topic is introduction and innovative approaches to the optimizing laboratory process. It's over to you, Asela.
Thank you very much, sir, for your kind introduction. Sir, can you hear me?
Go ahead. I can hear you. I can hear you. Please go ahead.
Thank you, sir. Good afternoon. Welcome to the second webinar organized by the College of Medical Administrators of Sri Lanka. First, I would like to thank the President and the Academic Chair, all office bearers, and members of the College of Medical Administrators of Sri Lanka for giving me this opportunity to share the knowledge with you all. Today, my topic is Introduction and Innovative Approach to Optimize the Laboratory Process. The Deputy Director General Laboratory Service is the focal point for laboratory services in the country. He provides policy formulation in relation to the national laboratory system, antimicrobial resistance, biosafety, and biosecurity, and gives technical guidance to all government sector laboratories with the Directorate of Laboratory Service. The Medical Research Institute and National Blood Transfusion Service are the two other main institutions functioning under the purview of DDG Laboratory Services, as you can see in this slide. Although private sector laboratories are regulated by the Private Health Service Regulatory Council, the laboratory service unit provide them with the technical guidance. Laboratory service consume only 5 to 10% of the hospital budget and help to 60 to 70% of critical decision making, such as admission, discharge, transfer, and the medication. Capital budget for the 2024 for the laboratory service is 720 million rupees. Laboratory service has separate vision and mission to work accordingly. Laboratory service are important in curative care in hospital, special campaign, public sector, surveillance purpose, and the National Medicine Quality Assurance Laboratory. In Sri Lanka, the public sector laboratory system is structured into a tiered system, which help to organize and manage the administrative functions and service delivery at different levels. Based on the recent classification, there are 5 levels of laboratories according to the level of institution. The level 1 is primary healthcare unit laboratories, and level 2 is divisional hospital laboratories. Level 3B is base hospital B, and level 3A is base hospital A. Level 4B is district general hospital laboratories, and the level 4A is national hospital, teaching hospital, and specialized hospital laboratories. Level 5 is the National Referral Center or the MRI. As you can see in this slide, the level 1 or the primary healthcare unit have only point of care machines like glucometer, UFR strips, and total cholesterol. The types of investigation increase gradually with the level of hospital, and level 5 or the reference laboratory having the facilities for almost all the investigations. When we consider the laboratory process, the laboratory investigation process consists of 3 phases: pre-analytical phase, analytical phase, and post-analytical phase. During the pre-analytical phase, patient identification, test ordering, sample collection, transportation, order verification, and sample processing are done. During the analytical phase, the sample will be analyzed, and the results verification, report interpretation, and management decisions were taken during the post-analytical phase. The time taken to this whole process is called the total turnaround time, and time taken within the laboratory is called the laboratory turnaround time. Laboratory policy was approved by the cabinet in 2006, and it is a comprehensive document. Important document like strategic plan, action plan, manual, guidelines, and circulars are available in the laboratory service for smooth regulation of functions. These are some of them. Laboratory service is a separate specialty under a Deputy Director General with a lot of responsibility. Now I am going to introduce a learning experience from District General Hospital in Sri Lanka. This was an interventional research project done by myself for my MD Part 2 exam. I would like to acknowledge my 2 supervisors, Dr. Sudat Dharmaratna, the former Deputy Director General Laboratory Service, and Dr. S.C. Vikramasinghe, Deputy Director General, NCD, for their guidance to make this a success. District General Hospital Mathli is one of the oldest hospitals in Sri Lanka and built in 1847 by a British administrators as a rural hospital. It is the largest healthcare institution in Mathli district with an average of 2,381 outpatients per week. My research is a project to improve the effectiveness of the laboratory investigation process of the outpatient department in the District General Hospital, Mathli. When we consider the effectiveness is doing the right thing and achieving desired objectives. Effectiveness in the laboratory process is multifaceted, encompassing internal dimensions such as timeliness, cost efficiency, and the quality refinement. External effectiveness of the laboratory service is directed towards enhancing patient satisfaction and cultivating a holistic approach to healthcare delivery. Accuracy and reliability ensure the right quality. The right quality to optimum patient care. It is major supportive service of curative healthcare institution, and much attention has been given to the laboratory service in past few years due to the importance of having accurate laboratory report in clinical management. Laboratory review meeting in District General Hospital, Mathale had identified that the effectiveness of the laboratory process was not satisfactory due to quality-related complaint, prolonged waiting time for investigation report, and a notable number of unattended investigations. These challenges result in patient dissatisfaction with the laboratory services provided. Necessity of this project was identified through laboratory review meetings, patient and staff complaints, and the view of administration. The general objective of the project is to improve the effectiveness of the laboratory investigation process of the outpatient department in the District General Hospital, Mathali. There are 5 specific objectives to describe the pre-interventional laboratory investigation process at OPD. Second one, to identify the gaps. Third one, to design the interventions. Fourth one, to implement the interventions. And the last one, to evaluate the effectiveness and the sustainability of the interventions conducted at outpatient department of the District General Hospital, Mathali. Under the methodology, there were several components. This was a before and after interventional research study was conducted in the 3 phases: pre-intervention, intervention, and post-intervention phase from 2nd January 2023 to 30th November 2023. 5 populations were studied in the pre-intervention and post-intervention phase. The populations were nursing officers, MLTs, patients, medical officers working in the OPD, and the study population for key informant interview and the focus group discussion. 9 study instruments were used for the pre and post intervention assessment, 3 self-administered questionnaire, 3 checklists, and a focus group discussion guide, and key informant interview guide, and the data collection sheet for the desk review. At the end of the pre-intervention phase, the current laboratory process was documented. Gap related to the cost, quality, and timeliness of the laboratory process was identified. This slide shows how I identified the gap in the process. First, I did the extensive literature review to identify the standard or the desired level of laboratory process and compare that desired or the standard process with the existing laboratory process and identify the gaps and categorize them. And excess number of investigations were requested due to the unavailability of guideline for requesting laboratory investigation at outpatient department. There were no proper investigation request form, and they used any piece of paper to request an investigation. And they were incomplete and difficult to read. Nursing officers' knowledge was satisfactory with the knowledge score of 75%. Other than the order of multiple sampling with single syringe was poor, and it was 4%. Though their knowledge was satisfactory, the practices were poor in the practice score of 41%. No proper identification of patient during the sample collection, no mixing of blood sample properly after bleeding, not explain what to do after collection of sample. They think collecting an excess volume of blood sample is all right and not affect to the accuracy of report. In addition, they do not use personal protective equipments. No proper labeling of the samples was done at the sample collection. Nursing officers handed over the sample tube to the patient without labeling. Patients are responsible to take that sample to the laboratory, which is situated 2 floors above the OPD. And the inconvenient location of the outpatient OPD laboratory with a limited space was a major issue there. A prolonged turnaround time was identified for the most commonly requesting investigation, like full blood count, it was 169 minutes. ESR, it was 224 minutes. And the UFR, it was 149 minutes. There was a single counter to receive sample and issue in the report. Poor documentation and poor management of analyzer and unavailability of non-conformity reporting system were identified as issue through qualitative assessment. End of the day, an average of 19% of unattended investigation at the OPD were detected. At the end of this initial assessment of the OPD laboratory process, the above described gaps were identified. With the participation of all stakeholders, interventions were identified to overcome those gaps. The interventions were prioritized using a prioritization matrix. The prioritization criteria were administrative, technical, and financial feasibility, relevance, impact, acceptance, and the time factor. The selected interventions were implemented as a package named the Driving Health Through Laboratory Excellence. The project was aligned with the National Health Laboratory Policy and Guideline and was conducted under the guidance of Deputy Director General Laboratory Service and the Director Laboratory Service. After obtaining the ethical and administrative approval, the project was executed by the Laboratory Development Committee. The project was funded by the Hospital Development Committee, well-wishers, and the government fund. Relocation of the OPD lab next to the OPD consultation room was done by the volunteers. The opening of the new OPD laboratory was done with the blessing of all stakeholders. 3 separate investigation request forms in different color were introduced, one for hematology, one for urinalysis, and one for the biochemistry section, which include the date, patient details with contact number, investigation, short clinical history, and the prescriber information. Investigation requesting guideline was developed and introduced through proper authority to minimize the unnecessary investigation. The sampling manual was developed with the help of consultant and introduced to improve the practices of nursing officers. Labeling of sample at the point of bleeding was made compulsory by issuing an internal circular. Today, capacity building program for nursing officers and MLT were conducted. It was funded by the ETNR unit, Ministry of Health. This is the non-conformity reporting form and the suggestion box were introduced to improve the laboratory service quality by scientifically analyzing suggestions and the reviews. Unattended investigation was sent as a WhatsApp message with instruction in 3 languages to the patient. If it is normal, mention as your investigation report as normal, and if it is not normal, meet your doctor immediately. Those messages are in 3 languages. An effective communication system was established to improve the communication between stakeholders. Standard operation procedure for analyzer were introduced to improve the management of analyzer. To the District General Hospital Matale, as requested by the project team, the patient registration, queue management were done through the system. The qualitative data were analyzed using the NBO 12 Pro software, and the quantitative data were analyzed using the SPSS version 26. These are the pre-intervention and post-intervention results with comparison. You can see that other than the attitude score, the all variables has improved significantly. Ultimately, the patient satisfaction score has improved from 71 to 79. Conclusion was implementing the driving health to laboratory excellence package, improve the effectiveness of the laboratory investigation process of outpatient department in the District General Hospital, Matale. These are my recommendations to develop the comprehensive guideline for investigation, all other investigation, to implement the regular training for laboratory staff, to update the skill, knowledge, and proficiency in handling new technologies, and adherence to the best practices. To open an efficient communication channel between the laboratory and the OPD to facilitate the prompt information sharing. To foster the collaboration among the laboratory, OPD, and other stakeholders through regular meetings, feedback session, and joint initiatives to address the challenges and improve the overall coordination. These are the measures to taken to establish the sustainability of the intervention. Participatory approach, well-functioning laboratory development committee, circulars, manual, guideline to ensure the adherence, continuous supply of resources, and with the motivated staff. Thank you. That's all.
Thank you very much, Asela. It's a really comprehensive work on how to increase the efficiency of the laboratory. So the next speaker is Dr. Bolonge Dayanath. He was the consultant chemical pathologist and head of the Department of Pathology, Colombo North Teaching Hospital, Sri Lanka. He's the current chemical pathologist, Dervish Pathology, Victoria, Australia. He was the past president of Association of Clinical Biochemists of Sri Lanka and the College of Chemical Pathologists of Sri Lanka. So he has got many other awards and many other publications as well. So his interest includes the toxicology, endocrinology, and laboratory informatics. So it's over to you, Dr. Dayanath. Dr. Dayanath, are you there? Asela?
Yes, sir.
Yeah, Dr. Dayanath is there.
So I informed, but I didn't check after that.
Just check whether he's. Until Dr. Dayanath, until Dr. Dayanath is available, let me brief what Dr. Asel has presented. First, he has really presented the services of the laboratory service in terms of the in terms of the governance structure, finance, as well as the functions. Then he really described about his study, how the laboratory services can be improved. From which I think he has given us a lot of evidence how we can just go ahead with this kind of process. So where he has developed a lot of guidelines about guidelines, sampling mechanism, as well as the SOPs, results, and everything. So that is the presentation from the previous speaker. Asel, have you found the next speaker?
So I inform him,
Yeah,
and
yeah,
he's connected. I think.
he's coming on the way, but
Yeah,
somebody has admitted him.
he's in the waiting room, so I can see.
Yeah, can you just admit him?
Yeah,
Can someone can admit him?
yeah,
Yeah, is
I,
yeah, yeah.
yes. Now he's
I-
there, sir.
yeah, right. All right. Dayanath, can you hear me, Dayanath? Dayanath?
33.
Hello?
Dayanath, can you hear me?
Yeah, I can hear.
Yeah, Dayanath, really, the first, I think we have got the presentation from the first speaker. You are the second speaker, and I have already read your biography. Would you be able to start your presentation, please?
Yes. Okay. First I will
Yeah, you need to
share.
share it. Yeah, yes. Can someone give access to? Yes. Okay, I'll allow you. Right. All right.
Okay.
Is someone recording this one? Reggie or Kasun? Anyway, once again, I just want to inform you that I have just shared a link in the chat box where we have got the YouTube channel as well. It's really live streaming at the college YouTube channel. The link is already there. So if someone wants to go through the YouTube, that's really good. Where you can just make your comments as well as anything over there. So, all right, it's going.
Wait, I think I have to.
I think Asela,
Yes, sir.
Asela, you need to go out of the screen sharing, please. Asela's one is still there. Asela,
Yes, sir.
your
Stop
screen is still
sharing.
there. Yeah, your screen is still there. Okay.
Can you see me my presentation
The
now?
screen in share is, yes, now I can see. Can you just go ahead with the full screen, please?
Yeah. Now okay.
Okay. I think we can see. Thank you very much. Please go ahead.
Okay. Right. Right. You can see, no?
Yes, we can see, Dr. Dana.
Right. First of all, I must thank Dr. Suranga Dolamulla and all organizers for inviting me to give this presentation. And my topic is optimizing lab service by improving operational effectiveness. Actually, some things, some points which I am elaborating, we have already in the past as well, we have discussed, but with my new experience, I am stressing some important points. Now, first, importance of laboratory service, because there are a lot of other services in the Ministry of Health or Health Department, but the laboratory services important in diagnosis, treatment, and monitoring, and prevention of diseases. That is also very important. And impact on public health, uh, data-driven decisions, especially chemical pathology, hematology, based on data, like what is the level of fasting blood sugar, what is the level of cholesterol, what is the level of TSH, like that. It is all data-driven. And then other important thing, even though we are not using very much in Sri Lanka, use of statistics, like because all these data, establishing reference ranges, looking at trends in diseases, predicting contributing factors for diseases, data-driven research. But are we using this currently? My opinion is we are not using much of these data. It is due to we don't have a very good data collection program like lab information system or system to capture only via, most of the time either it is in the instruments or in papers, which is not very good for analyzing. But other countries in the world doesn't rely on others' information. Like they have their own parameters, like their own reference ranges. Now, for example, in Australia, they have their own reference ranges for most of the analytes. And also they have like harmonized reference ranges. That is, entire state or entire country use same reference range for certain diseases or certain analytes. Now, laboratory service in Sri Lanka, uh, regulated, like we have two arms, government laboratory service and private laboratory service. According to my understanding, maybe government laboratory service providing around 70% service, and maybe private laboratory service giving around 30%. But I don't have that data. But this is my observation. Government laboratory services regulated by Ministry of Health or provincial councils. Oh, that means the central ministry or provincial councils, fully funded by the government, not for profit. Therefore, no cost effectiveness assessment. That is also some problem, and not accredited, not governed by a third party monitoring body, such as Sri Lanka Accreditation Board or somebody. But private laboratory service in Sri Lanka, regulated by PHSRC, funded by private organization, like maybe lab owners or some companies. It is profit based. Therefore, they regularly monitor cost and accredited some, but it is also not mandatory compared to like Australia. Australia, it is compulsory to have accreditation by NATA. If you don't have NATA accreditation, you can't run a lab. Like that, regulations are there. Now, government laboratory service in Sri Lanka, authoritative administrators, I think most of them are like in your category, like DDGHS, DDGLS, other DDGs like NCD, because they also some involved in some lab testing, at least point of care testing. Director laboratory service, provincial directors, special campaign directors, directors of hospitals, they all are decision makers. Even though pathologists or microbiologists are there, we also governed by these officers. Then you all know I am just to complete this. I'm just showing this hierarchical classification of laboratory network. We have a lot of primary medical care units, then divisional hospitals, base hospitals, categories, then district hospitals, then district general hospitals, provincial general hospitals, then national hospital and national reference laboratories with different level of testing. But that different level of testing is not very well established, even though classified here or in some other documents. Because when we go to some small hospitals, they have very big analyzers which are not using very much cost effectively. At the same time, in that area, big hospital may not have that instrument. It is not cost effective. Then operational effectiveness definition, because my topic in a business context, operational effectiveness is a measurement of resource allocation and can be defined as the ratio between an output gain from the business and input to run a business operation. That is what we put and what we gain. When improving operational efficiency, the output to input ratio improves. That means we are getting more in output than what we are putting in. That's why it grows. How it applies to laboratory services. Government laboratory service is also a business, we can say, of which resource allocation provided by the government is measured. Because we say we allocate this much of millions, blah, blah. But output is not measured directly. Directly measured, not measured means how much of test or what is the service we have provided. That is not statistically not very clearly measurable, but measured indirectly as an overall service delivery, because at the end maybe outcome of health services good. Therefore, operational effectiveness is not directly visualized. Difficult to identify ineffective areas to apply strategies to improve the operation. Because if we can categorize this area not effective, this area is effective, then we can improve that not effective areas. Then what are the components of lab operations? Test request, sample collection, sample transport, analysis, reporting. How to improve test request? Because that is a very bizarre area. Rational test ordering. Test ordering should be very rational. Should have some ideas about the cost spent for common and uncommon test by the user. That means doctors who are requesting should have some idea what is the cost spent by the government for a fasting blood sugar. What is the cost spent by the government for a TSH? Then what is the cost for TFT? Like if they say thyroid function, maybe we have to do FT4, FT3, TSH all. What is the cost for lipid profile? Like at least they should have some idea. Even when medical students comes, I ask two questions. What is the cost for a fasting blood sugar? What is the cost for a TSH? Even when they are at third year, they don't know. But maybe sometimes when we ask from doctors, they don't know. They don't have idea. But that should be there should be some input from our side. These are the costs we spend. Therefore, be careful in ordering. Should have some guidelines for test ordering. Australia, like in Australia, they have Medicare benefit schedule, like MBS online. Even we can just search and check the cost like Medicare benefit cost. And at the same time, they say some certain test. I'm not saying they say for all, but certain test. They say you can have, order only this much of time. This test. If you order more, we don't pay. Like that, there should be some governing. They say this is the cost, something like that. Now, test request, major colleges should publish guidelines in collaboration with pathology colleges. In the past we were discussing, but it's difficult, but we have to do somehow because other countries have done. Need some categorization of test ordering according to the institution. Then requesting hierarchy also should be defined, like consultant, SR, registrar, SHO, HO. Example, some investigations like vitamin D, aldosterone ratio, very expensive, needs to be signed by a consultant or SR. This needs to be done through education, but in even my practice when I was at Ragam, we time to time we send circulars, but it's not working because they should be educated. Minimize unnecessary repeats. Need to define retesting intervals. Need to provide clinical information important for validation as well as minimize repeating inside the lab. But repeat test ordering cannot be controlled because if we don't have a lab information system, we don't know whether this patient sample was done previously, like maybe 3 hours before, maybe yesterday, like that. There should be some mechanism developed in the lab information system. Do we have a system to monitor this pattern of request? Currently, no. Currently, no means we can employ, but if we employ, it is paper-based, but it is difficult. Now, options, common request form, which can be digitalized. We can prepare a common request form for the entire country for different disciplines. We can use that, and we can even digitalize it like scanning or whatever. Request through LIS or HIMS. It is electronic request. That should be our target in future. In Singapore, they do electronic request, but in Australia, we can't. But in Australia, what we do is we scan all request forms and digitalize. That is, it is converted to digital input. This will monitor requesting pattern. Then we can monitor what is over requested, like that. Currently difficult to monitor as paper-based in Sri Lanka. Long-term solution, introduce lab information management system or hospital information system with combination, which can capture this data and monitor. Then repeats comes because sometimes even in Ragama, when we check, sometimes we see around 70% repeats come. But because of LIS, we can capture. But if LI is not there, we can't capture because it's a waste. It is not effective operation. Then specimen collection. What is the current practice? Wards, units, primary healthcare centers, bleeding rooms of the hospitals. They send samples. These are the places where we collect samples. Phlebotomy procedures done by nurses. Some hospitals well equipped, bleeding rooms available, but some hospitals no. Just they have a chair, or because I have that experience. Paper-based labeling system, which is prone to error generation. Private sector special category available for drawing blood. They are called phlebotomist. Now, in Sri Lanka, is it economical to employ a well-trained nurse who is capable of doing multitask, so many other things? for only one procedure of bleeding and drawing blood in a bleeding room. I don't think it is very cost effective, because if you take total number of nurses employed in bleeding room in the country, maybe around 300, 200, because each and every hospital needs at least 2 or 3 nurses. So it is not cost effective or optimal operation. Options for improvement, there should be a special category like phlebotomist who can be trained only for sample collection procedure, can employ extra number of people to reduce the congestion in bleeding room rather than paying big sum for one nurse. But nursing officer can be in charge of such unit or team who is guiding them. Should move to electronic barcode labeling system, which is a component of LIS or HIMS. Then data entry process needs to be done at the point of sample collection without wasting time and papers. Collection speed up the process, because once the sample received by the laboratory, they can just run. For example, Ragama OPD, we have a barcoded collection system. When that rack comes, straight away after centrifugation, we just put entire rack to the system without wasting time on data entry. We just check the sample with the request form, and we say it is accepted on the system, our LIS system, and we say, okay, we can analyze straight away, and reporting is very fast. This will improve laboratory operations, sparing MLT's time spending for data entry, because they don't have to spend their time for data entry. They can be allocated for some other work, improve turnaround time. So employing or taking such decisions will improve the system. Then establishing a very good lab information system or specimen collection procedure can be streamlined. When the laboratory receive unregistered samples, need to register before analysis. Then who is registering samples in the lab currently? Because even though data entry done at OPD, but maybe wards, they can't do a data entry. We receive unentered samples, but it is done by MLTs. But MLTs do the registration process. Data entry process is less skilled work. Employing a well-skilled MLT for this less skilled job is not effective. Employing a data entry operators for this process will improve the system. MLTs can be in charge of the process and team. Private sector of Sri Lanka and other countries like maybe developed, even in India, even in Australia, they have a data entry operators. They just continuously do data entry, but they can't go and do operate analysis. But in our setup, our well-trained MLTs sit and do data entry. That is not effective. Employee effectiveness and efficiency is achieved in this way if we can do this. Then specimen transport. What is the current mode of transport of specimens? We have two methods, like intra-institutional transport and inter-institutional transport. One employee from intra-institutional transports, for example, my hospital, Ragam, one employee from one ward carries a specimen to the lab. If you have 40 wards, 40 people should come to the lab 40 times, several times a day, maybe more. Delay in transport, overall cost is very high, even though we don't calculate. We are not calculating. For example, with one tube, a person from 4th floor or 8th floor is coming to the lab, not adherent to health and safety regulations as different employees involved in this process. But inter-institutional transport, usually ambulance, while doing other patient transport, they carry samples maybe to National Hospital, maybe to MRI. But in periphery, maybe they are using three-wheelers or something like that. Not a dedicated service for sample transport. Delay in transport happens, sometimes sample missing, observed, a lot of things happening. Now, what are the solutions for operational effectiveness? Intra-institutional transport, introduction of a dedicated courier service inside the hospital. Rather than sending too many employees, dedicated employees can transport samples to define intervals. For example, at Ragama, Colombo North Teaching Hospital, we introduced a courier system covering entire hospital. Only 6 courier covering entire hospital entire day. But we were unable to do it in the night, but we did it daytime. Instead of getting a lot of people into the lab, we were able to do this very efficiently. Or in countries like Australia or maybe even India, in one hospital, KDU in Sri Lanka, we have a pneumatic tube transport system. This is very effective because, for example, as I mentioned earlier, maybe 10th floor of the hospital, they are carrying one sample to the lab. But if that person is only going in the maybe in the lift, it costs more. But if we have a pneumatic tube transport system, we can quickly send sample from that collection point, maybe in the ward, to the lab very quickly. And we should think of introducing such systems in future, maybe even though we can't do it now, in future, at least for national hospitals. Inter-institutional transport, introduction of a dedicated courier system. Should well-trained, covering several institutions to track through LIS or HIMS. All the private sector in Sri Lanka and other countries employ this method. They do rely they do relay system as well. They bring samples to one place and they bring samples to the other place, covering entire country. This will enhance providing equal service to any institution without reproducing lab service over there, because sometimes, because we can't transport a sample from one lab to the other, we decide to establish a lab, we decide to buy an instrument, we decide to get MLTs to our hospital. But we have a nearest hospital. We can transport. If we don't have a very big turnover of patients, no point establishing a big laboratory over there. We just send samples to other lab in cost-effective way. This courier system, this is long-awaited requirement to optimize laboratory processes. This will enhance the concept of satellite laboratory system. Without establishing fully equipped laboratories everywhere, we can transport samples to referral lab where more facilities available. Reports can be delivered through LIS or HIMS. Expenses to establish a lab in a small hospital, like infrastructure development, strengthening with equipment, increase of human resources, can be directed to the referral lab, which can be perform operations more effectively. So in this way, just introducing courier system will enhance the process. Current bottleneck is the lack of dedicated courier system to transport specimens. Lab service optimization process must introduce this system. In specimen reception, every laboratory must have a dedicated specimen reception. All samples received by the laboratory needs to be entered to the lab information system. Currently, what most of the hospitals does is they just write in a book, CR book or whatever, and just write down the BHT and just say test. Sometimes it's no point. Problem sample handling needs to be done at by the reception without disturbing operators in the laboratory. Reception supervising should be done by a dedicated MLT. Send out samples also need to be handled by the reception. Every function should be entered in the LIMS for tracking purpose. This will prevent unauthorized access to the laboratory as well, because everybody will not come into the lab. Then sample analysis. Sample analysis needs to have followings, because that is the most important part in the laboratory process. Human resources, instruments, infrastructure, continuous supply of reagents and consumables, then LIMS. Sample analysis, human resources, doctors, pathologists, registrars, MOs. Medical laboratory technologists, either diploma holders or medical laboratory science degree holders. Laboratory supporting staff. Need in future, according to my opinion, phlebotomists, data entry operators, and dedicated couriers. This will delegate some of the duties in cost-effective manner to a defined staff. Sample analysis, human resources, we have well-trained pathologists to lead the system. MO pathology need dedicated training by colleges with support of MOH. Sometimes there are some conflicts. We can make sure that conflicts will not happen if we introduce a training system for them as well. Then well-trained, dedicated MLTs. We have well-educated staff, either diploma holders or medical laboratory science, but minimum ongoing professional educational activities available. Only colleges do time to time ongoing activities. Maybe their colleges does, but it's not enough. No competence evaluation process available on the job. Laboratory supporting staff need more training and continuous educational activities. And lack of accreditation process has retarded this process. If we compare with private sector, they have accreditation targets. They need to do continuous professional activities. Need to introduce rewarding programs, such activities, and open up ladder for those who perform well. This will enhance and encourage the staff to dedicate and perform well. Then laboratories instruments. Selection of instruments needs to be done according to institutional and feeding institutions' requirements. Should be based on past and future prediction of test turnover. High throughput instruments needs to be employed rather than low throughput instruments. Larger workload can be handled by a lesser number of operators. No need of duplicate. If we have, say, 300 per hour, 2 instruments. But if we have 800 per hour, 1 instrument, that instrument, 2 instruments, if we have 2 instruments, we need to calibrate 2 instruments, we need to run quality controls for 2 instruments, we need to employ 2 or 3 MLTs for these 2 instruments. But if we have a big instrument, according to our workload, we can employ, and we don't have to run frequent, we don't have to duplicate calibration, we don't have to duplicate controls, and reagent wastage will not be there. A lot of advantages. Implementation of satellite laboratory system will enhance this process because we get large number of volume of samples to main lab. And if feeding labs send samples to the central lab, it will be more effective because we can run our lab in effective manner. As much as possible, need to encourage reagent rental placement of instruments. This is my opinion, but I don't know this. But no capital cost, no service and maintenance cost based on cost per test. And evaluation is easy and transparent. There's no hidden cost. Can go for contract, maybe 3 years, 4 years, 5 years. Most of the private sector and other countries, for example, now my hospital, we have a very large number of instruments, but all reagent rental contract basis, they count cost per test only, like they charge only for test. Should follow open tender process. If we purchase an instrument, when technology changes, for example, when we buy an instrument, we buy it for 5 years. But if the technology change, maybe even after 5 years, we have to replace some parts. We have to continue with that instrument. If we go for tender, because this instrument industry is rapidly changing, they send different models. It's like our iPhone, like maybe our vehicles. They also change. When very good instruments. Sometimes in the past, I can remember some our analyzers consume reagent 300 microliters. But with time, they produced instruments which consume only 180 microliters of reagents. But because we have purchased that previous instrument, we can't uh, get rid of that instrument to get a 180 microliter consuming instrument which is cost effective. Therefore, but by technology changes can be accepted by this system. Fear of high cost for reagent is a myth. All the private laboratories and most of the developed countries use this model as they calculate cost effectiveness. Laboratory instruments, implementation of front-end automation with lab information system linked to a middleware will streamline the laboratory processes for major laboratories essential. This is more effective than dumping of instruments for unnecessary laboratories. Rather than giving instruments to different small laboratories, if we can employ front-end automation, which enhance the process workflow, they can handle a lot of samples. Only thing we have to do is we have to get down all samples from with courier to our lab. We should encourage sample transport to a strengthened central laboratory, and carrying out sample analysis is more cost effective and quality assured. In the past, we did manual testing, like before 2000, when I was a trainee, most of the tests we did manual. Now all labs using automated instruments. Next step we should go is front-end automation. We have to automate that part as well. Now in my lab in Australia, we all front-end or we don't handle sample. We just put sample on the rack and it will automatically centrifuge. It will put on the instruments and do everything. We'll observe the difference once implemented. Until we implement at one place, we can't say the difference. But if we implement at one place, we will see the difference. Then laboratory infrastructure should be designed according to the service requirement. Essential components should be included. Open lab structure is the best for chemical pathology. Pathologists, MLTs, hospital directors, architects needs to have combined meetings to design lab. When designing should be a future prediction as well, because in 10 years time, what will be the lab like that. And also very good important thing is green lab concept should be taken into consideration. Now IFCC has given green lab concept. We should use that design when we are designing lab. Should use these ideas. Building one good laboratory is more effective than building up several small laboratories. Then continuous supply of reagents and consumables. This is very important. It is essential to provide continuous supply of reagents and consumables for sustainable laboratory service. Current method is paper-based, except for MSD reagents. MSD reagents we can order online. Reagent ordering should be based on statistics. What is the easiest way to get these statistics? Lab information should have provision to extract past statistics, perform test and calculate reagent consumption. That should be the way. By this method, can minimize reagent wastage, need to encourage to maintain digital LIS-based system in addition to traditional paper-based system. Very good lab information system will provide this facility. Can monitor transparency as well. We know what is happening in the instrument, whether it is repeats, whatever. Then current situation, can we get total number of full blood counts done for a period of 1 month in your lab? Yes, you can, but not instant. You can't instantly, you can't get. Not continuously monitoring. Statistics are taken into a book and time to time we are sending all to ministry, but these are not very well maintained, lack of traceability. Because once the instrument data is gone, it is gone. We don't know what amount of tests done on this instrument. Only our paper is there because the instrument can handle only may about 10,000 data. After 10,001, that first data is deleted automatically like that. Best answer is to go for good lab information system with all these facilities. When reagents ordered, directors as the supplying authority, you should know what was the production during last episode and what will be the production for the next episode. Current practice is indirect. When there are no complaints from wards, reagent supply is adequate. If there are complaints, reagent supply is inadequate. This is demand and supply strategy, but need to based on statistics to make sure a system is cost effective. Answer is a good lab information system. Then final thing, lab information system, because I repeatedly mentioned, this is an essential component which is an important as instrument, human resources and infrastructure. Because in the past we say we need infrastructure, human resources and lab instruments to run a lab. But we should say now we need a lab information system as well. Good lab information management system will integrate all lab instruments with human resources and enhance productivity of the laboratory. Can be implemented from the request insight to the report dispatch covering entire lab process. Will be a data mine for research, prediction of disease trends, etc. Statistics can analyze cost effectiveness, consideration of test volume to keep it, refer, etc. If we have lab information system for the entire country, which can communicate with HIS or HIMS, will enhance delivering, accessing results from any hospital in in Singapore. They can check results at any place. Then quality assurance and accreditation, all laboratories should be incorporated into some sort of accreditation program. This will make a target to achieve in quality way. Stage-wise accreditation will be a good system. We can't get the full lab accreditation instantly. It should be a graded accreditation, like giving some targets and giving some rewards to labs. In summary, laboratory service is an essential part in patient management. We have enough facilities but need reorganization with new strategies. Encouraging satellite laboratory system will be more cost effective. A laboratory information management system optimize all the aspects of lab operations in effective way. And thank you. any questions or?
It's really a mind-blowing presentation. Thank you very much, Dr. Diana.
Yes.
I think this is for the time for the Q&A session. Dr. Sudat Dharmaratna, the President-elect and former DDG Laboratory Services, is available with us. It's over to you, sir. I think we have got nearly 10 minutes for the Q&A session. Sir, will you be able to lead the Q&A session? Dr. Diana, can you just get out from screen sharing?
Presentation. Okay.
Presentation.
Yeah.
Thank
Okay. Stop share. Okay. Yeah.
Okay. Thank you very much. Dr. Sudat Asela, whether Dr. Sudat Dharma is available with you?
Yes. Surang,
Yes,
I'm
sir.
there.
Yes, sir.
Okay.
Would you be able to continue the Q&A session for 10 minutes?
Sure. Right. Okay. Am I audible?
Yes, sir. We can.
Yes, sir.
Thank you very much.
Yeah, we can hear.
Okay. First, let me thank both presenters, Dr. Asila Dissanayake and Dr. Jayanath. So, at long time, I see my friend Dr. Jayanath from Australia, right?
Yes.
Indeed,
For
he's
a short time, I will come back.
Sure. When you come back, we can develop the system and we can establish some strategies to improve the laboratory services in the country. Dr. Asela, in fact, he discussed his international project, what he has done for this MD examinations. Basically, that was done in Mahatale District General Hospital, Asela. So he has given very good insight on some recommendations, especially about training the laboratory staffs as well as improve the communication between the laboratory staff with the other stakeholders and to conduct regular meeting with the other stakeholders to improve the laboratory services. And also he has highlighted the levels of laboratories and developed some interventions, sampling, manual, and etc. So he has improved the laboratory service in Mahatale Hospital, and others also our trainees can follow him and engage in similar research in respect to hospitals is very important. Because what I'm saying like that, because after seeing the Dr. Dayanath presentation, he discussed a lot of things, I think very useful presentation. His comments are very valuable to improve the laboratory services. Actually, it's eye-opener. Okay. He discussed about operational effectiveness and efficiency of laboratory services. As directors, definitely we have to work with our laboratory consultants very closely if you want to improve the laboratory services. In one aspect, you have to measure the inputs in numbers, in terms of manpower, in terms of laboratory consultants, in terms of the MLTs, in terms of the money you spend on these equipments and etc. So there are so many inputs you are putting, and there will be a process, and you are getting some outputs. In outputs, then you have to measure the outputs. In Sri Lanka, I think few studies have been done with regard to this measurement of outputs. So we are trying to measure the outputs in terms of laboratory testing, the performance, or the number of tests performed in each level, each hospital. And also we should analyze the cost. That is another important concern. So we don't have data, right? What is the cost per test in each level in terms of immunology testing, microbiology testing, and also chemical pathology and hormone assays? We should have some kind of knowledge on the cost per test is very important. Unless otherwise you can't establish national ordering of testing. If our prescribing officers, they don't have any idea of the cost, definitely they will not rationalize the testing. They will keep on writing sometimes maybe unnecessary testing as well. Therefore, I think the college, especially our members, right? So I'm trying to encourage you all to conduct some research in collaboration with the laboratory consultants and the laboratory colleges, especially. Because Dr. Dayanand also mentioned, now we have to prepare some guidelines. So definitely the College of Medical Administrators can liaise with the College of Medical Pathologists, maybe this year or next year. We can prepare some guidelines on how to improve these laboratory services in the country. That is one of the major concerns here. And I asked our trainees to, this is a very interesting area. There are so many aspects, laboratory, laboratory turnaround time is a one area. And analyze the cost of reagents is one important. Analyze the number of test performance another area. And accreditation, the qualification is another important area. And LIM is another area. You can see many facets are there. So laboratory services, basically, it knows a lot of areas which are very equally important, so that you can study each and every area to improve if you want to improve laboratory services. Actually, Dr. Suranga and I, in the last 2 years, we were have a very good relation with these colleges, these laboratory consultants, our colleagues. We are trying to establish LIMS, laboratory management information system in the country. Yet there are some barriers as well, I think, but budget is there. Hopefully, next year we will try and establish this kind of system in the country. In fact, we visited Ragama Hospital, Dr. Suranga and I, and we met Dr. Dayanath. I saw his laboratory. So he's a person who establishes courier system in the hospital. He has done very well there. So therefore, very efficient courier system. He employed about, I think, 6 minor staff there. They are going in specific times to the boards and collecting these specimens. So that ensures some kind of efficiency in that, especially pre-clinical stage of the laboratories. So likewise, is just get Ministry of Health to the Secretary and our future strategies. So I think Sudan will agree with me. And we'll prepare some document and we will guide the Ministry of Health to and our administrators to go in that direction. It's very good presentation, and if you can share with us, yeah, we are very grateful to you. And because time is limited, I can take up another 2 or 3 questions from the audience. Our members are there, the college. So if you need any question, you can ask any question from me or Dr. Suranga, Dr. Dayana, and Dr. Asel is here. I think Dr. Kumar Vikram Singh, our president of the college, also has joined this audience. Isn't it, Dr. Suranga?
So I think he's not available today. Dr. Chula has informed me that he's a little busy, but he will try to join us in the later.
Yeah. Then yes, the audience, our members. I'm very thankful to the trainees who has initiated this kind of research on laboratory services, especially, right? Because a lot of researchers they have done on patient safety and satisfaction and other things are there. But recent years, I noticed that some of the trainees are very keen on improving laboratory services. So they have engaged some research on laboratory services and to develop the laboratory services. And Dr. Surang also helping them a lot as a supervisor. So as well as one of the senior registrar who has done something. And some of the previous, I think Dr. Kul, the director Badul has done some research on turnaround times. And Dr. Rumini Ranagale has done some research on medical equipment, something like that. So now our directors are doing this kind of research related to diagnostic, the diagnostic facilities and networking. These things are very, very, I think, important area. You have to explore that area further. So Suranga, we'll ask some of the participants to make their comments and any questions. We are happy to provide answers.
Yes, as you mentioned, it's a really two-way dialogue. I think we need some questions from the audience as well to improve the efficiency of this webinar series as well. So we have got many postgraduate trainees as well as working directors in this forum. So you may ask any of the questions, there's no problem. And as everyone knows that we have got a YouTube channel as well. The live streaming is going on. So you can even make any note on the YouTube channel, or you can make a comment. Even here you can make a not on the message box, or we can take it. We can take those questions here. Okay, so I have a question, very short one. So it's from our good friend Dr. Dayanath. He's with your experience now, when we just compare the Sri Lankan system and the Australian system, I know that we have to go mile to come to that level, but it's really a fact that still our system is evolving. But as you mentioned, in terms of the having the centralized laboratory is really cost efficient. But now in Australia, how do you manage to transport the samples in terms? It's a huge country. I think you are the area may be also really huge. So how do you really manage the transportation of your sample?
Yeah, last 4 months I worked at in Queensland. It is the largest state. It's a very large state, and our hospital, our laboratory, it is QML laboratory network. We had 3,000 collection centers, and we had 500 courier services, but because of Australia system, we had only big central laboratory, and our other, even though this state is very big, we had only like several small laboratories, but all the other samples come to either to that small laboratory or to our lab by courier. And that's why I said relay system. They bring samples to some other place, then they bring samples to our lab. Because main lab is getting a lot of samples, and we can improve our system very well. It is the same thing in Victoria. We are covering around 20 hospitals, our laboratory. They do basic testing do basic test there, but they send all like hormones and special testing to our lab by courier system. But courier system here is only by cars, because it is very difficult to ride motorcycles, and because of health and safety regulations, they don't allow motorcycles to bring samples. But uh, uh, by looking at this system, it is very, very cost effective in Sri Lanka if we can establish some kind of courier system. For my good example, in the past, we didn't have a cleaning service for hospitals. In the past, we didn't have a security system for service for hospitals. But now we have both. But this, rather than having these two, it is very important to have a very good courier system to cover up all this sample transport. Because by looking at the big country, because our country is small, and we also have very big hospitals in or big laboratories in each province, at least this provincial main laboratory should be strengthened and transport all samples to that place. Then maybe we can transport very, very highly specialized testing to maybe to National Hospital or MRI, Cancer Hospital or whatever, big hospital, big places or MRI for specialized testing. So it is essential service to be established.
Okay, thank you, Dr. Dayanath. It's really a good, really sort of a answer for my questions. So I think it's time to get a picture. Can you all just get into
Sir,
the...
I want to ask one question from Dr. Dana.
Yes.
Sir, Dr. Dana,
Yes, sir.
Yes, sir. Please go ahead.
now you mentioned about reagent rental replacement.
Yes.
Yeah, that is indeed a good idea.
Yeah.
Now see, we take two hospitals, right? One is Shragama and one is
Okay.
Kalubo.
Yeah.
Okay. Now Kalubo will a director
Mm-hmm.
and there is a Ragama director. There are two directors are there. Okay.
Okay.
Now Kalubo director wants to establish this reagent rental replacement model. Suppose you are the
Okay.
consultant there.
Mm-hmm.
Then I am the supplier. So I will supply all the machines and the maintenance free of charge
Okay.
to your hospital, right?
Okay. Yeah.
Then you have to analyze the number of tests you want to do at Kalubowil Hospital. And then I
Okay.
will give a fee. This is the cost per test I have to give because I have to get my break even, right? So
Okay.
I'm
Yeah.
offering a fee for the test per cost per test is something like that. Full blood count. This is my cost.
Yeah.
I
Yeah.
have to
Yeah. Yeah.
as a
Mm-hmm.
supplier, I tell you.
Yeah.
And then the Agama director
Mm-hmm.
maybe some other maybe other doctor here, right?
Mm-hmm.
He is using the same machines, already purchased machines, and the maintenance done by him. Then I have
Okay.
to offer different price, different cost per test, right?
Mm-hmm. Yeah.
Full blood count
Okay.
price. Now, okay. Now for Agma, full blood count, one full blood count price maybe I am offering for maybe about my cost maybe reagent cost maybe around as 100 rupees. But the
Mm-hmm.
Alubon hospital, I have to offer a price maybe about 150, right?
Okay. Yeah.
Then the third party private hospital, okay,
Mm-hmm.
maybe some of the private hospital, they're offering a full blood count for about 400 rupees.
Okay.
Another
Yeah.
scenario, I'm bringing another scenario.
Yeah. 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 I got it. Now, the thing,
Yeah.
that's why I mentioned it should be like open tender process. Like we say, mm, uh, our hospital now. That is what is happening in Australia. Even we say per year we are doing this much of full blood counts. This much of whatever say full blood count. This much of full blood count. Then different companies offering. Okay, we give for this much, we give for this much, we give for this much. And these are our performance specifications. Performance specifications means even though cost is very low, if it is not performed up to required level, we cannot accept. And by that, like then not only one company is offering, maybe different companies offering or like suppliers offering. Then we have to select from these suppliers. For example, as you mentioned now, Ragama may be getting 450, but private hospital is providing even having some profit 400. There should be some reason that maybe they are using some other system and Ragam may be using some other system. Definitely, reagent cost may be higher than outright purchase, but in the long run, uh, mm, it is cost effective if we calculate accurately. That's why I mentioned we need all these data like in the past. So, for example, we can go back if we have this data in the past. What is the amount we spent for maybe 2 years? And even this will be a good project for one of the postgraduate trainees. For example, this instrument. What was the cost for reagent purchase? Then what was the output? Then what was the cost per test? Like that. We have to go for open tender system. Thereby, by that way, we can select good method for good supply.
Okay, thank you,
If
Dr.
they are
Diana.
providing, if they are providing for a private hospital for lesser price, they should be able to provide it for our, because there should be some negotiation stage as well.
Okay, thank you, Dr. Diana.
That's
Thank
what
you so
happening
much.
here.
Thank you, thank you, Dr. Diana. Thank you.
Yeah.
Now, Surangan, our time is running up now. I have got another meeting, board of study meeting at 3
Yes, sir.
p.m.
We all have to go to the board of
Therefore,
study.
shall we take the photographs and find it
Yes,
out?
sir.
Okay, thank you.
Can you all just switch on your camera? And who's going to take Reggie or Kasun? I'm not sure about which way we need to go. Oh no, no. Only 6 are there. We want to get, who's going to get the picture? Yeah, can someone take the picture? Asela?
Stream.
Then so everyone is in the picture. Kasun, Asela, can you get a picture with everyone? Just we need to really set the view. This is the view. Otherwise, we have to get a half and half. Let's see.
A lot of people are here. You see, a lot of members,
Yeah.
lot of members, non-members.
Yes, and I have seen about sometime about 10 to 15 parts viewers from the YouTube channel as well, sir. So it's a really a good sort of the participation. Have someone take the picture? Okay, I'm also going to get one. Actually, we'll get another one. Okay, so I think now it's time for this closing sort of remarks. So let me really wind up this one. It's really with a very, very short closing remarks. It's really so right. So as we come to the close of the today, insightful and engaging webinar title, the Optimizing Laboratory Services by the Improving Operational Effectiveness, organized by the College of Medical Administrators of Sri Lanka. I would like to take a moment to express my gratitude to all of you for your participation and attention. I'm sure you will agree that we have covered some truly important grounds today. First, I would like to extend my heartiest thankful for our the former DDG Laboratory Service and the President-elect Dr. Sudatta Dharmaratna and esteemed speakers Dr. Asela Disanayaka, who gave us a strong start with his comprehensive introduction and innovative approaches to the optimizing laboratory practices. His insight into the latest strategies and even the strategies he has applied, as well as the tools for the enhancing the workflow efficiency, were both really enlightful as well as practical. Following that, we have got Dr. BKTP Diana, who's a chemical pathologist, currently working in Australia, further expanded our understanding by detailing how we can improve operational effectiveness within our laboratory services. This presentation highlighted the critical connection between the effective management and the overall quality and sustainability of the laboratory services, providing us with a clear takeaways that can be applied to our own institutions. Together, these presentations have equipped with us with valuable knowledge showing us in optimizing the laboratory services. It's not just about the technology or process improving alone. It is about aligning all aspects of the operational practices. So, on behalf of the College of Medical Ed Sri Lanka, I want to thank all the speakers and as well as Dr. Sudha Dharmaratne, who has participated from the president-elect as well. And all of you are joining this today. I look forward to seeing how we can improve your contribution in terms of the enhancing the laboratory services. Let's continue an important conversation beyond today's webinar and keep staying with us. You can even see this our presentations and everything from the YouTube channel as well, and you can disseminate this information about your colleagues. So that's from my end, and it's a great evening, and thank you very much for the participation. Have a great day. Thank you.
Okay, thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you. Okay, bye.